today. And, I'm going to turn it over to Bob to say a few things to kick you all off. But I'm super excited about this work session. I'm really excited about this work. This is some of the most important work we're doing in terms of behavioral health. And I'm really glad that we're getting this conversation going so early in the year for us. So with that, I'll turn it over to Bob.
Thanks. Thanks, Sarah. Can everybody hear me? I have a new headset and I'm not sure it's okay. Good, great, thanks. This is our first opportunity as the Behavioral Health Leadership Coalition to speak to the new commissioners. So good afternoon, Commissioner Reed and Commissioner Portillo, Commissioner Kelly. We are familiar faces to you. So we are super excited about this opportunity. It's hard to believe that the last time we had a conversation about prevention, it was a year ago. It was 12 months ago. There's been an awful lot of work that's taken place, and we're excited to kind of bring you up to date on things that have happened since the global pandemic created some large disruptions. I'm going to just provide a couple of comments and then I'm going to turn it over to our team, but let me take a moment to introduce our team. We have representatives today from Kansas Suicide Prevention Headquarters, from the Lawrence Douglas County Public Health, and of course DECA, who has been leading the Engaged Douglas County Prevention Coalition and being sort of the executive sponsors, along with Lori Alvarado from DECA, along with Dan Partridge being the executive sponsors of the prevention plank of the community health plan. Can we do some quick introductions, starting with Lori?
Sure. I am Lori Alvarado. I am the CEO at DECA and have been the executive sponsor for the prevention side of the Behavioral Health Leadership Coalition since its inception. So I'm excited to share some interesting news. I'll be talking towards the end.
Terrific. And also from DECA, we have Chrissy.
Hello, I'm Chrissy Mayer. I'm the Chief Community-Based Services Officer, kind of spearheading the prevention work for our team.
And then from Kansas Suicide Prevention Headquarters, we have Monica Kurse.
Hi, I'm Monica Kurse with KSPHQ. I'm our Vice President for External Programming, and I've been really excited to partner with Chrissy and the folks at DECA on the prevention initiatives.
In addition to Monica from Headquarters, we also have Meg Fowler.
Hello, Meg Fowler from KSPHQ, and I'm the Program Coordinator.
And we have a bit of a challenge. Dee Vernberg from the Lawrence Douglas County Health Department will join us. As everybody knows, public health is today is a vaccination clinic day and all hands are on deck. So I'm sure Dee will be joining us, but I also know that they have a lot on their plate this afternoon in continuing to help our community members become safer and ready to face the pandemic. So the Behavioral Health Leadership Coalition is an agency, as everybody knows, of 8 primary organizations in our community that have kind of spearheaded the work of redesigning our behavioral health system of care. This group came together in 2017 and has been working since that time to shepherd and steward the behavioral health plank of the community health plan. It is a coalition of executive level leaders in our community and the agencies that they represent, who have been providing the process of convening, strategizing, and again, helping to steward the work of the Behavioral Health Leadership Coalition and the work of the Community Health Plan. The coalition has a vision of creating an integrated system of behavioral health care that serves the whole purpose, their whole life, so they can realize their full potential. And the Community Health Plan has a goal of building an integrated system of care that moves from crisis and illness as a norm to recovery and prevention as a practice. So the Behavioral Health Leadership Coalition is the collective impact organization that stewards the behavioral health plank of the work, in similar ways to the Human Services Coalition being the collective impact organization that shepherds the poverty plank of the community health plan. I apologize that I'm losing my train of thought. This happens every once in a while on Zoom, so I'll get it back in a second. But in 2018, at the end of 2018, the community health plan was adopted. And within that plan, there were 7 objectives identified for behavioral health. This included reducing the number of people who present in the emergency department from 3,900 at the time to 3,120, reducing the percentage of booked individuals at the Douglas County Jail, decreasing the age-adjusted suicide rate from 16 to 14 per 100,000 people, reducing the proportions of persons 18 and older engaged in binge drinking during the past 30 days, reducing the total number of opioid prescriptions in Douglas County, increasing the proportion of adults 18 and older with serious mental illness who receive treatment, and increasing the proportion of adults who are homeless with mental health and mental health issues and problems who receive mental health services by 5%. The structure of the plan has 3 focus areas. And the first, and the one that we're here to talk about today, is to prioritize prevention. But in addition to that, the other 2 focus areas of the plan are to promote integration across the system of care and to improve access to care. Much of the energy of the Behavioral Health Leadership Coalition came together around trying to improve the facilities and services in our crisis continuum. And a lot of our time, energy, and bandwidth has been focused on improving that crisis continuum. But if all we do is to focus the bulk of our energy on crisis, we will not make a significant dent in improving the behavioral health of our community. So prevention really needs to be our priority. Prevention needs to be our focus. And if you look at the objectives in the plan, there are 3 specific objectives: decreasing the suicide rate in Douglas County, reducing the proportions of people aged 18 and older engaged in binge drinking, and reducing the total number of opioid prescriptions that were identified as strategies around which prevention plays a significant role. We have good news, and the good news is that the goal of reducing the number of opioid prescriptions in the community has been achieved. So that has happened in a short period of time. That's happened thanks to some significant leadership on the LMH Health, but then also support from agencies such as DECA, who have implemented a variety of strategies in our community that I'm sure Chrissy and the team will share. If you notice, though, these 3 objectives and much of what emerged in terms of the planning for the community health plan in 2017 and 2018 are really focused on adults. And so what I'm excited about this afternoon is you're going to hear some emerging strategies that have grown out of a coalition of stakeholders specifically focused on prevention and issues as they relate to youth and families in our community, and addressing issues that are linked to substance use, suicide prevention, and creating upstream solutions to get at those social determinants of health that really drive the health, the overall health of a community. One way I like to think of this is a lot of the energy that pulled this coalition together was focused on getting people the services they need, because the energy we heard from the community is people don't have the services they need. If we do our job correctly, we should be striving to live in a community where people don't need the services we have. And that work is the work of prevention. It's creating upstream solutions and finding ways to get ahead of issues related to crisis and escalation around those things. So the preliminary strategies in the prevention plank of the plan were to gather baseline data, develop a comprehensive strategic plan for prevention, provide My Strength to all Douglas County residents, implement zero suicide, and convene an annual behavioral health summit. We've made really great progress on implementing My Strength. There's a lot of work to be done in enrolling members of our community and getting them to use My Strength. We've made really significant progress on the first couple of steps of implementing zero suicide in Douglas County, including the implementation of the first Zero Suicide Academy in the state of Kansas, which took place this fall under headquarters leadership. What you're going to hear this afternoon are some emerging strategies to complement that effort to implement zero suicide within our healthcare agencies, and to meet to develop some strategies that speak to preventing suicide, substance use in elementary school students and in our secondary school students. So I'm very excited about the work that's being done by this coalition and the story that our partners are here to tell, and the progress that they're here to share. So with that, I'm going to turn it over to Chrissy Mayer from DECA, and I will stop sharing my screen.
All right, thanks, Bob. I appreciate the tee up for that information. Before we dive too deep into the presentation, though, I am curious if any of the commissioners have any specific questions about prevention work that you want to make sure we touch on today, or if there are particular things that you've heard about in the community that you might be curious about that you want to hear more about. I want to make sure that we're tailoring this to information you want to hear and want to know.
This is Commissioner Portillo. I do really appreciate in Bob's introduction the kind of framing around the focus on crisis and how we need to think about prevention as kind of an upstream piece to that and the social determinants of health. I do wonder, how are we balancing kind of the time, financial resources, collaborative efforts across community organizations, since so much of this is collaborative work? How do we balance those twin goals of prevention and crisis work? And how do we make sure that we're putting the resources in the places that make the most sense for our community?
Sure, that's a great question, and I think one that we will definitely be able to meet that need and figure out, and you'll be able to get that information as we move forward. Other specific questions related to the prevention work that we want to make sure we cover today?
Commissioner Reed, I think one thing I'm just curious about is with the youth-focused prevention, which I'm really excited to hear more about. What conversations, if any, have there been with the school districts throughout Douglas County about that, and knowing what their current buy-in to that process is? Perhaps it's a part of the plan, and you'll tell me about that. But
sure. Yep, absolutely. I think we're right on target for what you guys are looking for. Commissioner Kelly, do you have anything in particular that you're especially interested in today?
I would say mine is sort of aligned with Commissioner Reed's statement, and I'm specifically interested in, how we're motivating. I know from the deepest part of their heart they're going to want to do prevention work, but I do recognize that sometimes other priorities take precedent, and I know we have some experience with that, and some, and with some of our partners, and just interested to hear the strategies that you all are coming up with to sort of support engagement with our partners.
Great. I think we'll be able to get all of those things today. So I'm going to go ahead and start sharing my screen. Can everyone see that okay? All right, perfect. So just to kind of start off, maybe about the collaborative partnerships we're having, I think talking about Engage Douglas County is a great place to start. We have 43 members who come to our coalition meetings. So those are not everyone comes all at once, but just kind of partners who we were able to collaborate with and reach out to. And that was the first thing we did when we got started with this work, was identifying who were those community partners that we really needed to engage in this work to make sure we were hitting all the right targets in the community. So we looked at kind of the 12 community sectors that we were interested in. So groups like schools, like law enforcement, youth serving organizations, parents, youth, just a wide variety of people to see what we could do, what the interests might be, what priorities were for them. So we talked a lot about, here was the community health plan, and what else do we need to do? And that's where we started to dive into the strategic prevention framework, which is an evidence-based planning model for prevention work. So just know that when we're doing prevention work, we're using science-based approaches, things that we know are going to work. That is one thing we've been really intentional about doing, so that we're good stewards with the county dollars, is we want to make sure that we're doing things that are going to make a difference. And we've seen that in the past few years, we've seen that difference happen. So on the next slide, you will see just a few of our partners. So this doesn't list everyone. We're actually in the process of developing a website for Engage Douglas County. And these are the folks who've been able to send their logos over to me at this point. But we do have, as you can see, all 4 school districts in the county are huge partners with us. We cannot do this work without the schools. So superintendents have been very engaged. And we've actually had conversations with building level principals about how do we balance this work with what needs to happen during the school day, because schools can't be the catch-all for everything. And often the communities look to the schools for healthcare, for feeding their kids, for educating their kids, everything. And so we're really trying to figure out how can we support the schools in that regard. And so they've been great partners in talking about how we do this, not just in the school building, but outside of the school day, hitting youth as well. So we're so pleased with all the partnerships we have. And so we will just continue with some of those things here. I am going to share a few different data points. So as I mentioned before, our work is really data driven. Unfortunately, when we started this work in 2019, we had no usable data for the county related to youth. So that was our first ask of the school is, hey, can you all participate in the Kansas Communities That Care Student Survey? This is a free survey that's given to school districts across the state. And it's been in place since 1995. So it's a great database related to substance use, family issues, and then they recently added depression and suicide modules as well. So it was a really nice comprehensive tool for us. The schools were great, got on board, and in 2020, we had the first usable data for substance use and mental health among our youth. What we found was alcohol was our primary drug of choice for kids. Marijuana was a close second. Both of these are higher than average, higher than the state average. So in Douglas County in particular, alcohol and marijuana use are higher among our youth than other substances. Prior to 2020, we had to find out what else was happening with our kids. And so we did some supplementary data process. We did some youth focus groups. We also did some community readiness interviews with community partners. And basically what the youth focus groups were telling us was that vaping was a huge issue. So vaping kind of became our primary issue from 2019 to 2020 and trying to help address vaping amongst our students. And that was one thing the schools really came on board and said, we were having all sorts of challenges with vaping in the restrooms, vaping in the classroom, vaping everywhere, essentially. Community readiness interviews, those demonstrated that, yes, we think vaping's a problem, but we think mental health is more of the challenge. So it really showed there was a bit of a disconnect between mental health and substance use in the community. And so our goal is really trying to weave those two together. So then we got the good 2020 data. And then recently in December of 2020, we did some additional youth surveys and parent surveys because we wanted to get a pulse to see kind of what was happening. What the kids said in 2019, was it the same thing that they would be saying now? And it was a little bit different. Vaping had definitely dropped off the radar, which was an interesting thing, but we can correlate the work that Engage Douglas County did related to vaping to a decrease in student vaping as well. Just because we raised awareness, we did a lot of media campaign with it. We developed parent resources, resources for coaches, because that was one thing that youth were telling us in focus groups is that they connect with their coaches oftentimes. And so we connected with those groups that the youth were telling us that they connect with to be able to make a difference. So we've also seen in the 2020 data that alcohol has risen above vaping as a concern for both youth and parents. So we did this parent survey data. We had over 1,000 parents respond to the survey, and parents said, yes, alcohol is a problem. What we saw though too was that youth responses and parent responses, there was a bit of discrepancy between what youth thought and what parents thought. And so our youth coalition, the Douglas County Youth Prevention Board, or DCYPB, will actually be hosting a parent workshop to kind of talk about the data that they learned and kind of the differences and things that they want to work on with some of that. So that's exciting to see a lot of this youth-led initiative as well. Additionally, our data shows that mental health continues to be a concern, and that's why I'm so grateful for our partnership with Monica and Meg through the Kansas Suicide Prevention Headquarters, because they get it. They see how substance use and suicide are correlated and how we can coordinate this work together. Our response to some of these mental health issues has been sources of strength, which Meg and then one of our staff at DECA, Lydia Fuqua, have been awesome champions for in the community, facilitating this work with the schools. And we're actually piloting this program at Eudora High School. There's some interest at Lawrence High, and then also Baldwin High School right now. So it's starting to spread like wildfire a little bit. One more slide before I toss this to Monica to talk a little bit about suicide prevention is I just want to show you, this is the Kansas Communities That Care Student Survey. And thank you to Dee for pulling this data together. What the health department was able to do was kind of overlay the Kansas data with the Douglas County data. So the pink bars are the Kansas data and the blue bars are the Douglas County data. So you can see that alcohol use is significantly higher. And then marijuana use really in Douglas County is through the roof. There are lots of reasons for that and lots of things we can think about for that. But our win is right here with these e-cigarettes. You can see that Douglas County is no longer leading the way with vaping and e-cigarettes. So this is a big win for the prevention work that was happening in our community. So I will open this back up for questions before I turn this to Monica. Is there anything in this data that maybe surprises you or that you think is important for us to address as we go forward?
This is Commissioner Kelly. I was sort of surprised to see binge drinking where it is. That has been in our CHIP consistently high. Is that because this is youth, or do you have other interpretations of that?
Correct. This is primarily youth data. We will see, and I can certainly pull it and send it your way. We have a young adult survey that focuses on those 18 to 20-year-olds, and that's where we really see that binge drinking kind of go through the roof a little bit. Obviously, with the pandemic, we're not seeing it as publicly in bars and restaurants, places like that, but we are still seeing, house parties and use in general across the nation of alcohol is skyrocketing during the pandemic. So I think this will be reflected in our 2021 data. All right, if there's no other questions, Monica, I'm going to pitch this to you for the next slide.
I'm gonna find my unmute button. Thank you. So in the same vein that Chrissy was talking about, I thought that we would just take a look at a couple of the data points that we were able to gather from the Kansas Communities That Care survey with relation to depression and suicide. I am going to mirror Chrissy, and a big shout out to Dee over at the Public Health Department for pulling this together and helping us to put some of the Douglas County data into context. So what you're seeing here is a look at students who are reporting depression symptoms, and the KCTC is self-report. And so you'll see that in Douglas County, we have almost 40% of our 12th graders are reporting that they've experienced symptoms of depression, I believe, in the last year. And one of the things that Dee really pulled out of this that I think is meaningful as we kind of think about some of the topics that we're going to get to is that you'll see as we move from 6th grade to 8th grade to 10th grade to 12th grade, we're getting this kind of steady uptick in the number or the percentage of students, the number of students who are saying, yes, like depression is dragging me down. Depression is something that I'm having to deal with on a daily basis. Chrissy, do you mind advancing to the next slide? And so, I want to be very clear that I'm talking about depression and now I'm talking about suicide thoughts as if you have to be depressed before you have suicide thoughts. And that's not true. Not every student who reports depression is going to have suicidal thoughts, and not all of these students who are reporting suicidal thoughts would have necessarily said that they were feeling depressed. But I think that they're two important data points for us to take a look at. And we see that similar to depression, that by the time our students are getting to 12th grade, a higher proportion of them are reporting having suicide thoughts sometime in the last year. And so, you'll also see there that Douglas County trends above where the state average has been kind of year after year. So, but what I would like to kind of draw your attention to is that when I see this data, what it says to me is that we really do need to be thinking about how we can get upstream of this problem. So yes, let's think about how to address the need of these 6th, 8th, and 10th and 12th graders who are telling us that they're having thoughts of suicide. we absolutely need to pay attention to that. But we have a real opportunity, similar to what we did with vaping, to try to encourage some resilience, to encourage coping skills before we ever get to the 12th grade. So really think we need to prioritize growing those protective factors. Could I see the next slide? Oh, what, back one? Maybe. Yeah. And so kind of thinking about those protective factors, you know, my guess is that you are already aware when we talk about protective factors, we think about those things that are going to buffer your long-term risk for developing things like a substance use problem, becoming a tobacco user, dying by suicide, those kinds of pieces. And the reason I pulled this slide out in particular, where the Kansas Communities That Care survey has really looked at what our 6th graders are reporting as far as protective factors, is that protective factors are not just exclusive to drinking or drugging or smoking or depression or suicide, that we really see that many of these protective factors, when we target them and when we grow them, they're protective across the span of these risky behaviors that Engage Douglas County and the prevention initiatives are really trying to target. So when our 6th graders are telling us that they don't have as much of those, right? Like that the 6th graders in 2014 were reporting significantly higher social skills or family opportunities for involvement, that yes, you know, in 2020, I'm not necessarily surprised to see that those thoughts of suicide, that those depression reports are going up, and that we have an opportunity by targeting those protective factors to make a difference. So kind of thinking about those shared protective factors across alcohol and suicide prevention or substances and suicide prevention in particular. And then the next slide is not from the Kansas Communities That Care survey. So one of the good data sources that we have in Kansas as far as suicide data is concerned is the Kansas Violent Death Reporting System. Now, Dee and I could talk your ear off about the limitations of that data set, and given the opportunity, we absolutely would. I think that she and I both share a real passion for thinking about how to collect good mental health data and suicide prevention data, but it does provide us with some insights into what's going on with suicide in Kansas. And what I'm sharing with you here is some information that they've made available with regards to toxicology reports that are submitted by coroners after someone dies by suicide. So what you see is kind of the percentage of suicides where each of these individual substances was found in the person's system. And so why do I bring this up? Well, Chrissy talked a little bit earlier about how we see substance use and suicide prevention as being really linked. And so one of those ways that that's linked is protective factors, is risk factors, that as we target some of those shared risk and protective factors across risky behaviors, across those behavioral health indicators, that's one way that things are linked because we can protect in that way. And the other is a very practical link. And this has also been relevant in the work that we do with Zero Suicide. And that is that very often substance use and suicide behaviors and thoughts go hand in hand. So you'll see that in Kansas, about 35% of the time, alcohol was found in the system of the person who died by suicide. And why is that, right? Well, it happens for a couple of different reasons, but one of the things that we really, really point to is what alcohol and other substances do for inhibitions, right? And so we know that when someone is drinking, they are more likely to do something that they would not have done when they were sober, right? Like, I think my guess is that we can all think to a time in our lives, right, when that has been true for our alcohol consumption. And the thing to keep in mind with this is that that is very true for suicide thoughts as well. That if someone has been drinking, it becomes more possible, it becomes easier to act on your thoughts of suicide than it would have if you were sober. So when we're doing substance use prevention, when we're doing alcohol prevention, we're also protecting people from suicide. Because they have some of those natural barriers, some of those natural self-preservation instincts more intact. And we see that's really true across the lifespan. So again, I'm just going to say this is something that I could literally talk about all day. In fact, I've got some venues where you can come and listen to me talk about it for a couple of hours if you'd like to. But I do kind of want to pause here and just, I guess, kind of ask the commissioners in particular, anything here that we want to talk about a little bit more.
Monica, this Commissioner Kelly, can you go back a couple of slides? I'm interested in the data that you shared. One more, the two before that. And clearly you see this trend that happens across Kansas as they go from 6th to 8th to 10th grade, and then it plummets in 12th. And I mean, for us to jump in 12th is really interesting. And I just wonder, have you visited with schools about this? Is there, especially knowing that we've added mental health supports at both our high schools over the past few years, to see this is like, ouch. I mean, that something's not working there. So am I misinterpreting that?
I don't think that you're misinterpreting it. And I would look at Chrissy to see kind of what came up in the youth or the parent surveys. One thing that can be complicated, I think, about students as they're experiencing depression symptoms, as they're experiencing suicide risk, is that the why of it, right, is complicated.
Oh, sure.
And not really necessarily the same from student to student to student. And Meg, I'm going to invite you to like unmute and chat a little bit about your work with the youth as we talk about this. But you know, so we know that for some youth, like by the time that they get to 12th grade, perhaps they are starting to think about you know, whether or not their school performance is going to lead them in a direction where they get to achieve the goals that they thought they had for after high school, you know, especially in a higher education realm. So that may be true for some students. And we know that for other students, or maybe the same students as well, by the time we get to 12th grade, we've just kind of had that compounding impact of trauma by the time we get to 12th grade, and we see that happening more. But I think that you're exactly right, Commissioner Kelly, that I think we do need to kind of stop and look at this and say, how do we get ahead of it? And Meg is going to talk a little bit with you all about the Sources of Strength program that we think is one of the ways that we can get upstream.
Yes. So Sources of Strength is a program that is an upstream prevention program that's radically strengths-based. So the wheel that you see on the graphic here lists all of these strengths that we also think of as protective factors. The big benefit of Sources of Strength is that it is a peer-led program. So the youth are the ones putting out the messages, coming up with the content, and they're supported by a group of adult advisors, so that we can be sure the messaging is safe and that they have the support that they need should a youth have a crisis. We have research that shows that youth who are involved in Sources of Strength are 4 times more likely to have healthy help-seeking behavior. So if they are struggling, or if their peers are struggling, they are more likely to seek help from an adult. And the benefit of that, of course, is that the adult can then connect them to the long-term help that they need. Sources of Strength is evidence-based, which is a huge bonus, especially in suicide prevention, and substance misuse prevention, of course. And so the program is data informed, and it also uses data to show that healing and resilience is possible. One thing that really sticks out to me is that there is this focus on these strengths, right? So building skills within these different categories to be able to better overcome adversity if a crisis should arise. I had one more thing I was going to say and it escaped me. But we do have, are we going to also cover DCYPB? Okay, okay. So we have successfully implemented in Eudora High School so far. I was curious about how that would go. And when we logged on and we did small breakout rooms and things, I got so much feedback. And I know my training partner, Lydia Fuquay from DECA, also got this feedback that it just felt so good to log on and connect with other youth in this way, especially during the pandemic. And then for weeks following our youth training, we were getting emails from some of those adult advisors saying, we've had such an improvement in morale. We have students who are still talking about this training. And so they're really working hard to put out positive messaging and promote connectedness in the school community right now. We also have Lawrence High School, who is hopefully going to start training in April. So it is having a sort of, as Chrissy said, a wildfire effect on the community, which is really, really exciting. I could talk for days about this program because I am very passionate about it, but I know that we have a time limit, so I want to be respectful of that. But do you have any questions about sources of strength?
This is Commissioner Portillo. It sounds like a really great program. I love that it's evidence-based and data-driven. I do have a question, particularly when we think about things like spirituality being included in there. How are we also including aspects of thinking about social equity and social justice and ensuring that our minoritized and marginalized students aren't being left out or aren't being kind of focused on a particular normative viewpoint?
Right. They're also not being tokenized in that. So I think that that's an interesting, I think that it's interesting that you tied that question to spirituality, because when I initially was trained on this wheel, spirituality was the one thing that really stood out to me as being like a little, turned me off a little. But actually, after going through the training and seeing how they talk about spirituality as being even as simple as just gratitude, like learning about gratitude and talking about gratitude, it's not religious based at all. In terms of like social equity, the program really targets, the goal is to pull from literally every social group in the school. So it's not just targeting the football players and the students that are on student council, or like the students that are just always involved. It's really driven by diversity in terms of socioeconomic status, sexual orientation, gender identity, race, religion. All of these things are considered in that it's talked about in a way that isn't like prioritizing a certain identity, and inviting the like students who typically wouldn't involve themselves in social groups or clubs and that kind of thing. I don't know if that answered your question.
Yeah, and Meg, I might add that goes with the adult sponsors that were chosen for this project as well. They weren't your typical, like, for example, in Eudora, one of the shop teachers was selected, an at-risk teacher was selected, a math teacher. So, I mean, there was a lot of diversity in the selection of those adult advisors, so we could hit those different pockets of kids as well. Because it's important. And that actually did come up in our youth survey conversations around kids are feeling like sometimes they're treated differently based on the color of their skin or their sexual orientation. So that that did come up in our youth survey. And so that's something that the coalition is definitely paying attention to as we go forward.
Yeah, and I think that the adult advisors really set the tone for the group. So when you are able to pull in folks who work in the cafeteria and the janitorial staff, whoever has interest in that, it really does set an example that this group is for anyone in this school. It's not just for the super privileged kids.
Meg, this is Commissioner Reed here. Thanks everybody for all this. Sounds like some exciting stuff. And I like this wheel. I had similar thoughts to Commissioner Portillo about feeling like I had a bit of a reaction to the spirituality piece, and I'm sure it's a broader framework than that, but it does feel like it's missing some intentional focus on cultural connections and social lives and social justice and social status, and that those things are really key. So I think that I understand this is a framework that you all are working with, and I'm excited to hear that there's some intentional work being done to make sure that it's accessible by all kinds of students, in addition to all kinds of adults and faculty, and hope that especially with the peer-to-peer model, which is great to hear about. I think that's really important, that there's representation in those peer leaders, that they don't all fit one particular kind of social or familial or cultural archetype, and that there's really some intentional conversation about the role that people's race and ethnicity and social factors play. And that I think, you know, it can be easy to kind of skim over sometimes and just talk about diversity and inclusion in really generalized terms, and not give space for people to speak about their experience as a Black person, as an Indigenous youth, as you know, an immigrant youth. And so I hope that that's a really intentional part of it. I had a question earlier. Oh, I was just wondering, when thinking about, I was excited to hear that it's a peer-to-peer model and the adult advisors. Just curious what it looks like for, I guess, the training of those adult advisors, and assuming that many of them are mandated reporters by the nature of their profession. What does it look like in those trainings and then subsequent like meetings and group get-togethers to disclose that and be really clear that if there are mandated reporters present, and have informed consent about what youth are discussing with each other? If anybody can speak to that.
I think that's a really good question. And to be honest, I think it's something that we can start having discussions around. Particularly myself and my training partner, Lydia, who is here but can't talk for some reason. She's muted, but I think that that's a really important piece to consider.
We can move Lydia over if you want us to.
It might not hurt.
Yeah, why don't you go ahead and move her over? Because as we move, I might click on to the next slide, which kind of correlates with sources of strength. And then we'll talk a little bit about the Youth Coalition, which Lydia and Meg kind of spearhead, and I think you'll be interested to see some of that work as well. But Good Behavior Game is really kind of our primary level strategy around substance use and suicide prevention. And some people, when they hear this, it's like, why are we talking about substance use and suicide prevention with elementary students? Well, there's lots of correlations between what happens in early life and how things will happen later down the line. So that's where we're starting with Good Behavior Game. Good Behavior Game is often referred to as a behavioral vaccine. And you can see some data on the slide here talking about kids who get this as kindergartners, first graders, or second graders have better outcomes over time. They're less likely to use drugs, less likely to smoke, less likely to have violent and criminal behavior. And this is some information we shared with the Criminal Justice Coordinating Council as well, just about the program, just because we can make correlations between adults who are in our criminal justice system and things that happen in their early childhood, youth, trauma-based pieces as well. Again, you can see suicidal thoughts decline as well. Really great context around good behavior game. This is currently being piloted in Baldwin. Initially, it was just the kindergarten teachers who went through. The kindergarten teachers did it and they're like, we need our first and second grade teachers to go through. So the principal in Baldwin is a huge advocate for the program and had all of their teachers K through 2 trained in the program. They're seeing great outcomes in Baldwin for this. They're seeing less disruptions in the classroom. They're seeing kids staying on task longer. They're seeing less outbursts in school. And so we're curious to see over time. So these kids who got this in kindergarten, first grade, second grade, what is it going to look like when they're sixth graders? What is their data going to look like when it shows up in here? And that's the thing about prevention is it takes a while to see how these interventions impact. It takes a while to see change over time. It's not an instantaneous thing. So we're excited to see how that shakes out. Next, this is kind of the crown jewel. This is the youth board. And Lydia, do you want me to turn this to you to talk about? And I do have the video that the youth did as well, so I can show that, or if you want to do a little bit of chat about what the youth have done. Oh, Lydia, we can't hear you.
How about now?
There you go.
That double mute button gets me every time. Sure, I'd be happy to talk a little bit about DCYPB. My name's Lydia Fuquay. I'm a prevention specialist at DECA, and I'm one of the adult sponsors for DCYPB, along with Meg and a couple of other adults, Stan Armstrong and Laura McCulloch. DCYPB has made a lot of progress in the last year. We just celebrated our first birthday, so that's very exciting. We're 13 members strong. You can see some of our members on the screen here. They've really done an awesome job of adapting to a virtual environment without really letting them slow them down at all. We've completed several projects this year, actually, despite being virtual. Several things related to both substance misuse prevention and mental health. 2 of our most recent projects included a 30-day mental wellness challenge that we hosted for teens and the community at large on our Instagram. And that was quite a success. It occurred during December, so it was a nice time to get an emotional boost of energy every day. And then our Help Stop the Spread scavenger hunt just wrapped up, and that was part of the Kansas Leadership Center's Kansas Beats the Virus project in partnership with KDHE. The teens created a digital scavenger hunt for other teens to learn more about COVID-19, the real facts about COVID-19, how to protect themselves, how to protect others, and then the resources that were available to them in Douglas County. And participants received a free mask designed by a DCYPB member for participating. We had 138 teens participate. So great participation on that. And then moving forward, we hope to implement DCYPB groups in Douglas County high schools this fall, potentially. So that's a little bit about the youth board. I'd be happy to answer any questions as well.
Thanks, Lydia. Do you want me to pop in I can show the video as well. I'm going to stop for a minute and then maybe we can see that video and then open it up for questions. So
that'd be great.
Start sharing again. All right.
So we have some DCYPB members here, and they'd like to share just a little bit about why they're involved with DCYPB or a project that they're proud of. So I'm going to turn the floor over to them, and we'll start with Campbell.
Hello, Mayor. I'm in 9th grade at Eudora High School, and I just really enjoy coming to all the DCYPB meetings everywhere. It's just a nice highlight to my one day.
Awesome. Thank you, Campbell, for sharing. Let's hear from Lexi next.
I'm Lexi Willow. I'm in 9th grade and I go to Free State. I enjoy here and like learning about the community and get to meet new friends.
Awesome. Thank you so much, Lexi. All right, let's hear from Mackenzie.
Hi, I'm Mackenzie Mayer. I'm an 11th grader at Eudora High School, and I joined DCYPB to make a difference in my community, and I have a passion for helping people, and I feel like this is a good way to go about doing that.
I love that. Thank you, Mackenzie. And last but not least, let's hear from Ling.
I'm a 11th grade at Eudora High School, and I joined because prevention work is something that I'm interested in, and I really enjoy making a difference in my community and in my school.
Wonderful. Thank you, Ling. Thank you to all four of you for sharing a little bit about your perspective and your involvement with DCYPB. And thanks to everybody who took the time to watch this video.
All right. So that was just a little perspective from the youth. As Lydia mentioned, there are 13 students involved in the project. And so that was just a short snapshot of what was happening. So are there questions about the youth board at this point? Okay, if not, I'm going to go back to my screen here.
This is Commissioner Reed. I have one quick question, but you can keep sharing your screen. I was just wondering if there is a youth representative on, perhaps, well, maybe not the BHLC, but I don't know. I'm just wondering if there's any particular connection, I guess, or representative from this youth prevention board that is involved in the larger community work around behavioral health. And I asked that as somebody who, when I was in high school here, was doing work with some other youth to try and get youth membership and representation on different nonprofit and kind of social services boards. So just curious if that's been a conversation.
So the answer to the question is no, but it's certainly something that we should talk more about. It's an opportunity to have that conversation, and those conversations are always good and important. So thank you for opening that door. But this group has briefed the members of what?
Hey, Bob, I think that we would like to answer that question a little bit different for the Engaged Douglas County.
Yeah. So, okay. I heard the question as, is there a youth representative on the BHLC?
I did, and I'm sorry, that was kind of a meandering question, because then I was looking back at my notes and thinking, well, maybe for Engage, also in realizing that there are some different entities. So yeah, I just wanted to pose that thought anyway.
Yeah, and on the, for Engage Douglas County, we are, and this is Lori, we'll talk about this as kind of our keynote. We do have youth representation on that group. The challenge, I think maybe that might happen with the BHLC is meeting time. It's difficult to get kids to pop out of school to go to a BHLC meeting. And we want to be sure too that we're not tokenizing the kids of, oh, okay, we have a kid, check. So, you know, how do we make that a value to them? And so we're really trying to use DCYPB as that place to build those kids up, because as you can see, there were 2 freshmen and 2 juniors who talked, and the juniors were maybe a little more comfortable talking and doing things, and the freshmen are maybe a little more reserved. And so that's one thing that Lydia and Meg have done a really nice job of trying to teach these kids to advocate. And one of the pictures on here, they went to the State House and met with their representatives to talk about tobacco work. And so I think that's definitely important to have youth engaged in this work, and they certainly are with Engage Douglas County anyway. The final piece that I have here before I turn it over to Lori to share some exciting news with you all is I just want to highlight some of the media work that has been done. And I'd invite you to like our page on Facebook or Instagram. We did a project in partnership with Engage Douglas County partners utilizing the hashtag DGCO Prevention Project. This was in November of 2019. And we reached over 9,000 people with that project. And these are just a few of those images that we shared. So we talked a lot about increasing awareness about suicide, encouraging parents to talk to their kids about substance use, about mental health, just so that we can be engaged and be partners with this. And as I said earlier, we are in the process of putting together an Engage Douglas County website. And so there will be good content there for people to connect with as a resource anyway. So with that, I will turn it to Lori to wrap us up, and then we will open up for more questions.
Well, I get to share some really exciting news. You got to hear about this effort and how we've engaged data and how we've engaged youth and how we've engaged different partners across our county, really towards some singular kinds of efforts around reducing risk factors and increasing protective factors. And we, DECA headed up a federal grant application to receive it's a federal drug-free communities grant. We received notice in January. I think we got official notice in January. We knew in December, but we didn't have anything official. So we received official notification in January. This is $125,000 per year for 5 years. It's really moving this coalition forward. And this particular money will be focused on alcohol and marijuana. You saw our data there. The county money was used to leverage this, so it was used as a match. So we definitely were in partnership with the county and all of our partners on putting this plan together. And we are excited that for 5 years, we will have $125,000 each year coming in to continue to move our strategies forward and to really solidify that prevention focus. And we're very excited that we were able to use county money, the investment that you all have made as a county, to leverage additional resources to come into this work. And I think that is indicative of the work that we've done in the county. These grants are not funded without good data. They're not funded without representation, a broad representation of the community. They're not funded unless you have really key evidence-based strategies that you're prepared to implement and have support. And so our letters of commitment from a lot of the partners have really put us in a good place to really launch this work. These grants have been around since 1997, and they've been awarded all over the nation. And it's really about building that infrastructure for local partners to create and sustain a reduction of youth substance abuse, and in turn, protection factors against both substance abuse and suicide, and increasing mental health promotion. So the Engage Douglas County Coalition will be engaged in moving this work forward. Their name is Engage. They are going to be engaged in this work going forward. And it's a nice connection to an ongoing sustaining effort. So we're super excited to make that official announcement to you all. It has not been released to the public yet. You are the first to hear in a public setting of this grant award. And so it really shows you, if we come together as a community, we use data, we use evidence-based practice, we engage very diverse facets of our community, it really does get the attention, and it gives us resources to move forward. So with that, I wanted to make that announcement. And I think at this point, we just want to make sure there are no further questions or comments or things that we can clarify for all of you. And thanks for this time today.
This is Commissioner Portillo. Not a question. I just wanted to say congratulations on the grant. That is wonderful news. And I'm glad to hear about the collaborative efforts in the community that made it happen.
Thank you. And I do want to touch on, this was really, what we shared with you today was really just a tiny piece of things that have been happening. There's so many other things that are happening, from opioid prevention work with our pharmacies. We've done some partnering with local coffee shops and pizza restaurants to promote vaping prevention and suicide prevention. So we're really trying to integrate this work across the board. And so there's definitely more to share, but with limited time, these were kind of a few of the highlights.
This is Commissioner Kelly. I do have a couple of questions. One would be, I asked early on at the top when Chrissy, when you asked like, what questions do we have? And I'm really interested on the partners that are engaged. A lot of what we talked about was, these are schools going to be doing this. A lot of the work that you're hoping this to be done is in schools. And so I'm taken by the fact that there's no schools here today, no districts represented, no principals, and so how are you working with those school leaders, and are they bought into the same goals that you're bought into? I mean, are you looking at it from that data perspective?
Sure, yes. And I would say, yes, they are. The superintendents have been very engaged in the work. Additionally, they've passed that to some of their building level principals. So Mark Pruitt at Lawrence High School has been super engaged and interested in getting some youth work going at the high school. Jose Cornejo as well with the Lawrence School District. Paul Dorothy in Baldwin has been a big champion for this work, and we're connecting with some of their rap workers in that building as well. JB Elliott, he actually connected his family and consumer sciences teacher to Lydia because he's like, hey, we need this in our school as well. So I think the challenge with schools, which I'm sure you're familiar with, is there's 100 other things happening right now related to COVID. And then, oh, hey, we have to do state assessments when we really haven't been in school a whole lot. So there's a lot of other things happening. And so what we're really trying to do, and the superintendents have been good champions for this, is making the connection between kind of a whole child, whole health. So looking at not just academics, but, our kids mentally well, our kids, protected from substances. So they have been good champions for this. And I would say maybe we were remiss in not including them in this presentation just as a, I don't know, maybe it was an oversight on my part of, I don't want to ask them to do one more thing, but just this afternoon, from 1 to 2:30, Bill DeWitt and Jose Cornejo and then some staff from Baldwin were sitting in with me on a school mental health learning community sponsored by kind of a 4-state region. So people are really interested in trying to learn. I think it's just a matter of we're trying not to overtap them and trying to be mindful of time. So I think, but you pointed out, it does look like a big missing gap when, schools are where kids are. But then we're trying to partner with people like Boys and Girls Club to identify, are there places that we can connect with kids outside of the school day? Just because there are things that happen outside of the school day that we need to be connecting kids with. So a very valid point.
And Commissioner Kelly, I just want to jump for 1 second to also say that I think there's 2 levels of participation by the school leadership. So there's been very active engagement by the superintendents and their team, as Chrissy says, on the Engaged Douglas County Coalition. But then in addition to that, all 4 superintendents have been meeting fairly regularly. Even we've been meeting, even though they've been meeting through Unified Command, to talk about 3 priorities. One is sharing data. The second is coordinating the prevention work and priorities. And then the third area that they agreed to look at was looking at school alternatives. So, it's because of those 2 levels of engagement and collaboration that we had agreement from all 4 school districts, for example, to participate in the KCTC data survey for the first time in 6 years. So it's very much an issue of this particular time slot might not have been the ideal time to ask the superintendents today.
Well, and I would just say, I don't mean to, I know getting the CTC survey done was huge. I know firsthand that was a huge, and that the grant wouldn't have happened probably without that CTC survey. So I do recognize that, and those are steps. The one thing I do worry about, and we may need to have another conversation about this, is when we implement curriculum in school districts, we don't usually start from a grassroots. It has to be consistent across the district. So to Commissioner Portillo's question, we're going to look at any curriculum with a culturally relevant, culturally sustainable rubric. And I want to make sure that we have done that work so that we're not trying to build it up from the bottom, that it really has an approach that the district has said, yes, this is a good resource. So when we use words like spirituality, we've thought about how does that impact our teachers, our students, our families. When we think about wanting to make sure all cultures are represented, not only in the materials, but also in the teaching of it, that's just work that needs to be done. And I don't want us to, it is great stuff, but I want to make sure we go through all those processes, and those people at the school district who are partners on that have bought into, yes, we need to move forward on these metrics. And the way we're going to do it is with these resources, whether it's the good behavior game or those things. And I think we can do that. I don't want us to get frustrated because, this is 2 systems working here, right? And that's really, we got to make sure we cover those. So that was really a high level thing and really in the weeds a little bit, but I do want to encourage us to bring those partners together in a way that they're as invested in this as this group is.
I appreciate that, Commissioner Kelly. And as we think about these interventions and things that we move forward, I think having those conversations at the beginning are critical. And I know that we've done that with some of our school district partners. And at the same time, we're working with 4 school districts that have varying ways in which they choose to implement priorities. And so we're finding ourselves dancing occasionally about consistency of an intervention at the same time meeting the needs of a particular school district and a particular focus. So I take that as a huge, yes, we need to put that in the forefront of our minds, and at the same time bring in folks who can help us kind of manage that piece of the work, because we are also, all of us on this call are not school district people. And so we have to build collaborative relationships versus having any sort of even informal authority, right? We don't even have that. And so we're mindful of how do we engage across a different system in Baldwin than there is in Eudora and in Perry and in Lawrence. And so I think we would take any help, support, ideas, connections that any of you have to help us do that more effectively.
You know, and this is Sarah, I just want to chime in a little bit that the Douglas County, we have pulled together all the superintendents since like 2018 to have, you know, those conversations used to be every other month, Bob. And then during the pandemic, we slowed down, but, you know, I'm particularly mindful of like a presentation that Dee made on our youth suicide numbers to those directly to those superintendents, and in a way that would be hard to get a health department analyst directly in front of all of them together in a private space where they could ask her detailed questions without having a school, you know, board behind them and worried about that, where that access and that ability to talk about where the problem is was really important. And I do look forward to those opportunities to continue to sort of engage that group with the county on these topics, but also others, you know, because I'm trying to, we want to be supportive of them in that space, but also, you know, I just know they have so many things pulling at their attention, but there's been some really powerful stuff happened over the history of this group so far.
Just one thing I would add about our work, we are missing a couple of sectors in our Engage Douglas County group. And so I know you commissioners from time to time come in contact with people who are looking for places to connect and volunteer and engage. 2 areas that we are actively recruiting now are parents. And I mean parents who come from just a parent perspective. I'm a parent, right? But I also come from a professional lens of this prevention work. So we're looking for some parents who might want to join and lend their perspective just from a parent perspective. And I don't mean just, but purely from that parent lens. And then faith community, that is also an area that the drug-free communities really pushes to have as part of the sector, just as a way to have a balanced approach. And so those are areas, particular areas that we'll be recruiting. So I know you sometimes have folks that come to you and ask for places to engage. So while we'll take anybody who wants to engage in Engage Douglas County, those are particular audiences we'll be doing some specific recruiting for.
This is Commissioner Reed here. I don't have any questions. I just wanted to say thank you for answering all my questions, and thanks to everybody for taking the time this afternoon to give us a good framing of what's going on. Oh, and hi, baby. No, please, it's like my favorite part of Zoom meetings, truly. Babies and cats and puppies.
Her dad was doing a really good job, and we reached the end of the rope. So
maybe she has something to add to the conversation. I just really want to appreciate that there are so many moving parts to this work, and to speak to what Commissioner Portillo mentioned in the beginning of the conversation, that to really try and focus on prevention work while simultaneously making sure that we are equipped to respond to crisis is no small feat, and it takes a lot of players willing to do a lot of different layers of the work. And I know that for many of you on this call that your work overlaps crisis and prevention work, and I know that that is a struggle sometimes, but I appreciate that there is some really collaborative focus from a multitude of sectors in the community, figuring out how to have a plan to integrate prevention into all these various parts of our entire community, and to know that that's some long-term planning that really has to be taking place and kind of underwrite the crisis work that we are also acutely focused on and have to have measures for. So thank you for all the work that it's taken to have these conversations and do the work so far, and collaborate amongst it's important because it all is interconnected, but I also acknowledge that it is difficult from a systemic perspective sometimes for various private and public partnerships to figure out the path forward. So thanks for doing that work.
Thank you. We appreciate the time today, and please feel free, if you're interested in learning more about Engage Douglas County or even being on our mailing list, let me know, and I'm glad to put you on there so you can get updates about the coalition and activities that are occurring. But again, thank you for your time today. It's nice to be able to share the work that's happened in the community.
Thank you all, and we will recess until 5:30 for our business meeting. Really appreciate the time this afternoon.